Thanks, Rachel.
You're welcome.
Rachel, I just want to check something. Are you there?
Yes, sorry, I was trying to get off mute.
I am looking. I just want to make sure this is a public meeting, right?
Yes.
Okay. I was looking at so the invite is, we have an invite that's internal. We have an invite that's internal that is our OSP team and some others, and then the link that other external people will be joining from is how they would get in. I'm just noticing we don't have any external people on the call. I was just checking the invite. Okay, thanks. Hi, everybody. So I'm worried that something is amiss.
How was this advertised? Because I'm looking at the events page and there's nothing here, and I'm looking on the Cascade Care Savings page and there's nothing about the public meeting.
We worked with comms to send out an email.
There's someone.
Oh my gosh. Hi, everyone. This is Christine Javert with The Exchange. We have recognized that a few folks have been able to join. We think we may have had some technical difficulties with this meeting or link. So I recognize that we've got at least a few people external to HBE. So that's a good sign, but it is also a confusing sign that there's only so few. So I think we need to check into it. I apologize for those of you who have joined. Just kind of concerned about the way the meeting was shared. All right. Thanks, everyone. Good afternoon. This is Christine Joubert with The Exchange. We will go ahead and jump into the content today. We are here in an open public meeting to discuss Cascade Care Savings and the methodology for development of the amount, the per person per month amount of the Cascade Care Savings subsidy for plan year 2023. I would ask maybe in terms of introductions, if folks that are joining could introduce yourselves in chat, that would be really helpful. And I will just be introducing policy analyst Julia Nestor, who will be kind of providing an introduction and some background. And then we'll be leaning on our team from Wakely Consulting, who have been the actuaries developing the methodology and amount to walk you all through their work. So with that, I'll hand it over to Julia.
Hi all. I'm Julia Nestor. Oh, sorry, Rachel, next slide. And I'm a policy analyst with OSP. I wanted to begin by giving an introduction to Cascade Care Savings Policy, provide a bit of background, and at a high level, talk about the impact of Cascade Care Savings. So as a reminder, the public comment period for Cascade Care Savings amount methodology ends today. If you have any written comments that you haven't already submitted, please remember to submit them to the cascadecare@wabbyexchange.org email address, which is on the slide. And then please use public comment in the subject line so we don't miss it. And alternatively, we have time at the end of this presentation if you would like to provide any comments or if you have any questions you'd like us to answer. Next slide. So as a reminder, Cascade Care is the exchange's primary affordability initiative. Cascade Care seeks to increase the availability of quality, affordable health coverage in the individual market. We do that through addressing addressing costs through lower premiums, encourage more informed consumer choice, ensure continued market stability, and always have an eye towards continued enrollment growth. So Cascade Care's aims and goals are accomplished through our three key efforts of Cascade Care, which are our standard plans, the public options, and the state premium assistance, which is now known as our Cascade Care Savings. Next slide, please. So Cascade Care can be thought of as a three-legged stool, with one leg being the standard plans, one leg being the public option, and our last is the state subsidy, so our Cascade Care Savings. And I wanted to focus in on Cascade Care Savings here. So during the 2021 legislative session, the Washington State Legislature passed Senate Bill 5377, which directed the exchange to establish a state premium assistance for Washington residents. In 2021, state operating budget, $50 million in funding was provided to extend premium assistance to Washington residents earning up to 250% of the federal poverty level beginning in 2023. Next slide, please. Oh, sorry, there's a graphic. Next slide. Thanks. So we see this policy coming at an opportune time and is serving multiple goals. So our goal with Cascade Care Savings Policy is to reduce the uninsured rate in Washington while advancing health equity. This policy aligns with the ending of the PHE and can act as a bridge for individuals in Washington who churn between Medicaid and qualified health plan eligibility by reducing barriers to continuous coverage for this population and other populations vulnerable to being uninsured. And in addition, with the extension of the ARPA subsidies, we have an opportunity to provide much more affordable premiums through this program. Next slide, please. So now let's talk about the value of Cascade Care Savings and what it will bring to our customers. To put an income that is at or below 250% of the federal poverty level into perspective, that's essentially minimum wage. So for a household of one, it's an annual income of $32,200. And then for a family of three, it's $54,900. And our Cascade Care modeling shows us that in conjunction with the continued savings from ARPA and the Inflation Reduction Act, we'll have over 90,000 enrollees receiving Cascade Care savings. And they will have a $5 average net premium for those who with federal and state subsidies. And we just want to point out the caveat that the final modeling and Cascade Care Savings subsidy amount won't be finally set until after rates are finalized. Next slide, please. So as a reminder, our state-funded premium subsidies will lower monthly premium payments for eligible customers starting in 2023. It will wrap around with the available federal premium tax credits. And Cascade Care Savings will be available exclusively through Washington Health Plan Finder, which is also where eligibility will be determined. And unlike federal subsidy or the APTC, the exchange is paying the premium assistance directly to the carrier on behalf of the customer. Next slide, please. So we are on track for a successful launch on November 1st, 2022. The Cascade Care Savings Policy has been final as of May 2022, following several drafts of public comment periods, several drafts and public comment periods, which I'm sure many of you were a part of, so thank you again for that. Cascade Care Savings SEP began July 2022 and is available monthly to qualified customers. And as a reminder, this is an SEP that allows customers not enrolled in a Cascade Care Silver or Gold plan who are at or below 250% of the federal poverty level to be able to use a monthly SEP to sign up for Cascade Care Savings eligible plan. We have completed key carrier testing milestones, including 820 and 834 testing. Our technical build is more than 90% complete, with final build incorporating feedback from customer user experience. And on our communications front, our training and outreach teams are developing and rolling out materials to many of our external stakeholders, which included a webinar in July. So I will be handing this presentation off to our actuarial consultants, Wakely, to dive into the details of why we are all here today, the methodology for determining the amount of subsidy eligible customers can receive in 2023. Thank you.
Thank you, Julia. Can you all hear me okay?
Yes.
Perfect. Thanks, Christine. Great. My name is Ksenia Woodtall. I'm one of the actuaries with Wakely Consulting Group that's been working with WABI to analyze a lot of the subsidy program and estimate the subsidy amounts. Next slide, please. So today what I will walk through are results of our updated analysis that we conducted over the last month or so and highlight some of the key differences and changes from our prior estimates that we put together in March. Next slide, please. All right, so before I share with you the results of the recent analysis, I'd like to set the stage and highlight some of our key assumptions and results from our March work. So back in March, we estimated the Cascade savings PMPM amount to be $150 PMPM in the event that ARPA subsidies were to be continued in 2023. And that estimate was based on several, actually lots of different assumptions, but the three key drivers of that amount were our starting enrollment. On exchange enrollment figures were based on a January snapshot plan selection enrollment, of course, which then gets adjusted for a portion of effectuated members and other adjustments, but that really served as our base jumping off point for the projections. Also, at that time, we of course had no indication of what 2023 premium increases would look like. So we used a 2% assumed increase, which was really based on past historic averages over recent several years. And so that assumption then informed projected enrollment and take-up, and therefore the subsidy estimate. And then final key assumption was that the public health emergency would have ended in July of this current year. And so the redetermination process would then get started. And by the time we get to January 2023, we would have quite a few individuals already enrolled in ACA coverage. Of course, that didn't happen. And so as of now, the expectation is that the PHE will continue through the end of 2022, and then redetermination will begin and span that 12 months of 2023 calendar year. So our most recent analysis, we've trued up our enrollment starting point to more closely resemble the actual enrollment as of April of 2022. As a point of reference, we did note that the April enrollment figures, even post-effectuation adjustments, came in slightly lower than we were anticipating in our March work. And so in general, we're projecting off a lower base of individuals enrolled on exchange. The second big driver was the initial look at 2023 filed rates, where we saw kind of a weighted average increase, or just under 8%, which was significantly higher than what we anticipated, right? That 2% figure back in March. And combined with the fact that the benchmark plan rate, so the second lowest cost silver plan in a particular area and county, did not increase at that same rate of 7 or 8%, but actually increased at under 1%. That effect had the effect of those two items had on lowering the APTC subsidies as a result. The PHE assumption I mentioned, so we've updated that, and therefore our growth in the ACA potential enrollment in 2023 is now slightly lower due to the timing of the PHE. And then two last smaller impact items were to incorporate a potential fix to the family glitch issue that's proposed to be implemented in 2023. It is still not final, but we've assumed it will be approved and implemented. That has a pretty minor impact on the overall enrollment and therefore the subsidy projections. But again, we did reflect that in this round. And then the final item that we've updated was more accurately reflecting the availability of the Cascade savings special enrollment period starting in July of this year. So that's been taken into account as well, and therefore we expect slightly higher enrollment as a result of that. As Julia mentioned, we'll have to do one final tweak and true up of these estimates once the plan rates are finalized, middle of September. And so we'll take a look at the impact of that once that happens. Next slide, please. Thank you. As Julia mentioned, so the overall funding that's been appropriated for this program is $50 million. $5 million of that amount we set aside to use in the event of high enrollment than what we estimate to be our best estimate enrollment. So when we solve for, the largest state premium subsidy that could be offered, rounded to the nearest, $5 PMPM, we really try to maximize the 45 million funding amount. And we also solve for a single subsidy PMPM that will be available to those individuals that are currently receiving federal subsidies and those that are currently not eligible for federal subsidies. The eligibility criteria set for the Cascade Care Savings is those subsidies are available only to members enrolling in either Silver or Gold, Cascade Care or Cascade Care Select plans. Those individuals need to have incomes below 250% FPL. And in the event that there is significantly higher enrollment than what we've estimated and planned for with the current level of subsidy, there will be a contingency plan where enrollment could be capped at any point in the year where we are estimating we would exceed the funding allocated. Next slide, please. And the next. Great. So this chart summarizes a few key outputs of our analysis. As you can imagine, enrollment is an extremely sensitive variable in this analysis. And so we always include a range around our estimates. We start our analysis with our best estimate of enrollment, and using that enrollment, we then back into the subsidy estimate, which we estimated to be $215 per member per month. You can see that at that level, we project to need about $43 million, so just under that 45 million target funding amount. With the $215 PMPM, we estimate to attract additional 13,000, just over 13,000 new enrollees, the majority of whom will be coming from the uninsured pool of individuals in Washington, and a small portion would be migrating from off-exchange plans into the on-exchange. Overall, 90,000 members enrolled on exchange would be receiving these state subsidy amounts in our best estimate scenario. Really quickly, you can see how these figures vary between low and high enrollment scenarios. And really the low enrollment scenario reflects an environment where, given high premium increases that we are expecting, right, in 2023, that could lead to just overall lower take-up, still higher amounts that members would need to pay out of pocket for any kind of a residual net premiums post federal and state subsidies. And so you can see in that event, we estimate only 74,000 members receiving the state subsidies and only 9,000 new enrollees entering the market. And under the high enrollment scenario, you'll note that by providing the $215 subsidy amount, we're actually going to be slightly exceeding the total funding appropriation of $50 million by 1.7 million. So that's definitely a risk that's out there. Again, there is, in this event that this happens, the enrollment would need to be capped at some point in the year. And so, again, there are some mechanisms to mitigate us exceeding the total funding, but something definitely to be aware of. Next slide, please. This chart provides just a little bit more insight into the key levers in our low, best, and high enrollment scenarios. It probably has more detail than you necessarily want to look at here, but just to highlight a few key assumptions related to Medicaid redetermination impact. So in our best enrollment scenario, we estimate about 7,000 individuals would enroll post PHE end and redetermination process being put back into place. And then under high enrollment scenario, that number nearly doubles to just under 13,000 members. In the low scenario, we assume that no members from that pool enroll in ACA exchanges. Some of the additional items on this chart really reflect the impact of truing up to that April enrollment, including the impact of those additional family glitch impacts, SEP, as well as the premium increases in 2023. Okay, next slide, please. Okay. So what we're showing on this slide is kind of a visual look at how the premiums on average will look and compare between a world where there are no state subsidies, which is the chart you see on the left-hand side, and we'll start there. So this is something we call our baseline, where there's no state subsidies in place. The leftmost 3 bars represent average premiums that individuals who are currently eligible for federal subsidies are paying, and how those premiums break down between the APTC or the federal subsidy, so the orange bar, and then the residual net premium that member is responsible for paying. So you can see that for members with incomes up to 250% FPL, those net premiums are pretty minimal currently, ranging from $24 to $59 on average. Certainly there are values outside of that range. And then for individuals with slightly higher incomes above 250, you can see that approximately 60% of their premium is again being covered by the APTC, but they're still paying a fair share of the residual amount. If we look at the blue bars on the right-hand side there, those represent the unsubsidized individuals. So they're paying the entire portion of the premium, and you can see those amounts are pretty sizable. Now, if we turn to the chart on the right-hand side here, so this is showing individuals only with incomes under 250% FPL and hence eligible for state subsidy program. The key differences here, of course, is that for those that are also receiving the federal subsidies and receiving the state subsidy amount, the residual net premium that they have left is really minimal, averaging to $3 PMPM. Now, please note that that's an average amount of lots of zeros, right? And then some amounts that are greater than that, of course. For those that are individuals on the utmost right side, there are the 2 bars. They're not receiving the federal subsidies, and so you can see that the state subsidy is quite a significant portion of their gross premium, and therefore their net premium is significantly reduced. Next slide. We're back looking at our enrollment and comparing it to before and after state subsidy implementation, and how that enrollment breaks down between various segments of population, depending on which subsidies they're receiving. So if we start on our left-hand side here, to the left of the blue line, I should say. Again, we're looking at the enrollment of those who are receiving the federal subsidies. That's the majority of the market, 150,000 members. You can see that the colors in that bar represent the income splits, right? So we have vast majority of members who are subsidized under 250% FPL. Significant numbers still are above 250 there as well. The individuals not receiving federal subsidies are generally all above 250% FPL. And again, this is with ARPA subsidies, which are richer, continuing in 2023. On the right-hand side of the blue line here, what we kind of broke down here is how that enrollment changes between those individuals who are receiving both federal and state subsidies. We have just under 86,000 of those individuals. Majority of them are under 250% FPL, as you would expect. The next bar, 78,000 members are expected to be receiving federal subsidies only. And so their incomes are higher. They're not eligible for Cascade Care. Or they're also purchasing plans of other metal levels. Really small number of 4,300 individuals there receiving only state subsidies. So this represents a cohort of individuals that are not otherwise eligible for APTCs due to ESI offer that's deemed affordable for them. And so that disqualifies them from APTCs. And then finally, we still have just under 60,000 of individuals who are not eligible to receive any type of subsidy in the market. Next slide, please. Great. So to wrap this up, in the big changes in our subsidy estimates from our prior results, so from $150 PMPM to $215 PMPM, is really driven by a slightly lower enrollment anticipated as a result of timing of the PHE, higher 2023 premium increases, and also just a slightly lower enrollment in recent months on the exchange. Again, there is a large number of uncertainties in this analysis, as I mentioned. You saw the impact of varying enrollment scenarios under low and high, and how that translates into the amount of funding that is being utilized with this level of subsidy. We mentioned that we'll fine-tune this when the rates are finalized later this month. Of course, now we do have certainty that ARPA subsidies will continue into 2023. And then we'll also incorporate kind of auto crosswalks of members who will be auto-enrolled into a new plan, and it sounds like there are potentially more members are being renewed into a Cascade Care plan specifically, so that might have implications on that updated analysis. Next slide, please. Okay, and so now just to leave you with some questions, I'm not sure how we want to structure the discussion and Q&A, but maybe I'll just highlight some of these questions and hand it back to Julia and Christine. I guess our key questions to you are, what are your reactions to the updated enrollment premium estimates and the subsidy amount estimates? Do you have any questions regarding methodology, any of the assumptions that were not mentioned, as well as these results? There are definite risks that are inherent in any program that relies on consumer behavior and uncertainty related to that. So do you have any concerns with the risk in offering potentially a higher subsidy amount in order to utilize the full funding allocated to this program, and at the cost of risk of either needing to cap enrollment right throughout the month, or potentially exceeding that appropriation. And what is our risk tolerance to that possibility? And I think the last question, again, this speaks to the same goals, right? We want to make best use of the funding and provide most value to the consumers on the exchange while balancing the risks and the unknowns that we're facing. Next slide. That's it. Yeah, so maybe Julie and Christine, I'll hand that back to you, and I'm happy to answer any questions and go from there.
Thanks, Rachel. If you could go to the very last slide, we have our email address back up again. And so just wanted to remind everybody that our comment period closes today. And please email us or take the opportunity now to ask us any questions or give us any of your comments.
Hi, this is Christine. I know we only have a few external folks on the line, but I do want to just see if anyone had any comment, thoughts, reactions to some of the questions that Ksenia teed up around kind of the way the methodology has been structured, the assumptions underlying that high, best, and low enrollment assumptions, and some of the risk and kind of trade-offs that she highlighted. Any thoughts there? Anything you all are willing to share?
Nothing from us. It seems very similar to what we saw in the previous meeting. So I think we're good.
Okay, great. Thank you, Fawn. Any others? Any last comments before we close? Again, we will be taking any other, written feedback. The public comment period is closing today. This recording will be available. So you can always reach out, you know where to find us. But any last comments for today? All right. Thank you so much, everyone. Thank you, Ksenia and Julia. Thanks for everyone who joined today.
Thank you.